Time now for the live coronavirus update for San Antonio and Bexar County.
Good evening. I'm Mayor Nirenberg with Bexar County Judge Nelson Wolf, and tonight we're joined by Rita Espinoza, who is our Chief of Epidemiology here at San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting yet another day of more than 1,000 new cases of COVID-19, 1,283 cases since yesterday, which has pushed the 7-day moving average to 1,123. The total number of cases since the pandemic began is 103,447. Unfortunately, we also have 5 new deaths to report tonight, 3 Hispanic males in their 40s and 50s, a black female in her 80s, and a Hispanic female in her 90s. That brings the total deaths in our community to COVID-19 to 1,460. Please keep their family and friends in your prayers as we do all of our colleagues and friends and neighbors who we've lost during this pandemic. The stress in our hospital system continues to increase as well. We have 889 COVID-19 patients in the hospitals tonight. That's up 23 from yesterday. Overnight, we had 109 admissions. We have 286 patients on ICU with COVID-19 and 146 on ventilators. It is Monday. Our warning and progress indicators show much of the same. Numbers are steadily increasing. Cases per 1,000 is up slightly to 51.2, and the positivity rate is up again, nearly 2 percentage points to 14.4%. We are, so you know, testing about 8,000 people per day now, which is very good, which means we are able to identify and trace and isolate cases quickly as this has unfolded. All told, the risk level in our community remains moderate but worsening. So let me turn it over now to Judge Wolf.
Well, thanks, Mayor, and you're right. It's getting worse and it's not going to get better. I think when you think about where we are, and I didn't expect it to get this bad, I must tell you, and I know it's going to get worse. We ran into Halloween, Thanksgiving, Christmas coming, New Year's coming, and we literally have tens of thousands of people out there shopping, whether it's in a Target or a Walmart or a mall, and so I think that's part of it probably, because this is where we're headed. Could be worse than where we were this summer if things don't change. And I know it's about human behavior. I know that the vast majority of everybody tries to be very, very careful, but of course there's those that don't have a really high regard for other people. So it's a very dangerous time. Family gatherings, I know, you have to be very careful. So, we're just going to take extra precautions over these next several days, or January we're going to be in really serious trouble. And it's unfortunate, that just as we're getting the vaccines, that things are going bad for us, and it's kind of like rushing to the aid of someone and not quite getting there in time. And that's pretty much where we are with the vaccines, with what we're going to be facing. But we are moving forward. The mayor and I were out at Bexar County Hospital District, University Hospital, as they started administering vaccines. At this point, we've given 2,000 already just to our employees, and then at the Robert B. Greene, they're giving vaccinations to EMS people with the fire department. So we're starting. We know Moderna, I guess, will be here next few days. Easier to transport, but I'm afraid that it's a little late in the game to save everybody, and we're just going to have to really be careful the next several days.
Thank you, Judge. And with the amount of virus that's out there, you should be forewarned and treat everyone you encounter that's not part of your household as if they had the infection. So wear your mask when you're out and about and within 6 feet of anyone. And that is a good rule of thumb, as we've been saying, the Public Health Authority has been saying from the very start. I do also want to give an update on the emergency that's happening within the pandemic, and that is on our inventory of blood. The inventory of type O blood, which is used in emergencies, has finally reached a 3-day supply, which means that we're at what's considered the minimum level for our community. But we're still lagging behind the 7-day supply of type O blood that is needed. And there are more challenges ahead. The last 2 weeks of September are the slowest time of year for blood donations, and this year the South Texas Blood and Tissue Center is projecting a shortfall of at least 30%. We have to turn that around to meet the needs of patients in our hospitals because the need for blood never ends. And our hospitals have more procedures scheduled than usual as they work to provide treatments that were postponed earlier this year. This week there's an increase in the number of transplant surgeries planned. There are liver transplants scheduled every day this week at local hospitals, and those are especially blood intensive. One of those patients is 20-year-old Hagen Hill, who is scheduled to receive her second liver transplant tomorrow. She and her family have worked tirelessly to encourage blood donations, and so I was one of a few folks today who were able to give blood in her honor. And we do wish Hagen and all the other patients in our hospitals a very speedy recovery. So if you're able, please help us keep the momentum going and schedule an appointment to donate. The South Texas Blood and Tissue Center has 6 donor rooms in the area and is holding several community blood drives this month. You can make an appointment at southtexasblood.org or schedule to give blood at University Hospital by calling 210-358-2812. And we know that many people are struggling throughout this pandemic, and we want you to know that the county and the city have assistance programs available for you. If you are in need of emergency housing assistance or looking for job training to get into a job that is available for you safely right now, you can find more information on these programs by calling 311, or you can enroll in the job training program by calling 210-224-HELP. And as always, you can get the latest on COVID-19 in our community by texting COSAGUB to 55000, or by going to the website covid19.sanantonio.gov. Please help us save members of our community by masking up, keep physical distance, and practice safe hygiene. Do it for yourself, do it for your family, and do it for our community here in San Antonio. We'll go to questions now.
This briefing is continuing right now on KENS5.com and our Facebook page. A quick recap of the numbers. There's 1,283 new cases, bringing the total to now more than 103,000. The 7-day rolling average now at 1,123. Unfortunately, there is 5 new deaths tonight, bringing the death toll at 1,460. The coronavirus risk level sits at moderate, and the mayor also giving us an update on the blood donations, and he says that the level is at minimum for the available blood inventory. So if you can donate, please do so at the multiple locations at the South Texas Blood and Tissue Center.